So the next case we are proceeding for the EUS with is of a 50-year-old female. She had abdominal pain and jaundice for about a month. Her CT scan showed a heterogeneously enhancing mass identified at the region of second part of the duodenum involving the ampulla of Vater, causing circumferential mural thickening and significant luminal narrowing with single wall thickness of about 1.2 centimeters. It is causing obstruction at this level with obstructive dilatation of the CVD, for which we have placed a stent in on 16th of April. The ERCP showed a large growth at the ampullary region, and cannulation was achieved, and stent was placed in the CVD. So we are now proceeding with the EUS.
तो अभी ट्रांसमिट हो रहा है कि नहीं? Can you hear us? Oh.
Can you hear us?
Yes. So you got the history, right? Can you hear me? Okay. So we're going to get started. You got the history, right, Farooq?
So it's a
Sorry, I can't hear you right now.
me. Hello.
Hello, yep.
So it's a periampullary mass. It had an ERCP and a stented, and now we're here to assess the ampulla.
Well, yeah, I think it's more of a staging. This case was done in the last couple of days.
Right.
She clearly has an ampullary tumor that Dr. Khalid did a ERCP and placed a biliary stent.
Okay.
And it's an ulcerated infiltrating type mass involving the entire papilla, part of the second portion. So I think it's staging. The lesion clearly is not endoscopically resectable, but we can look for lymph nodes, we can look for liver mets. We can try and study the lesion, but it's very friable. I remember just touching it with the ERCP scope, it was oozing.
Oh, I see.
So we may not necessarily, we may look at it to show the audience, but we may not necessarily go to the second portion and do an EUS there.
I see. Okay.
You know, it's in the patient's best interest. And then what we discussed in terms of the learning objectives, passage of the echoendoscope safely into the esophagus and stomach, identifying the pancreas and other structures through the stomach, and hopefully also attempting to identify some structures from the duodenal bulb.
And intubation by trainee, right?
Yes, intubation by trainee.
Good, thank you.
Yeah. थोड़ा करीब से पकड़ लें. You're too far. 25. And just think of it like an ERCP. I wouldn't overthink it. Careful, careful, careful. It's in वापस आए बाय. Come on. So hold it like you would for an ERCP. Firmly. Thumb थोड़ा सा down. एक second करें. Other way. बस इतना to get you over the tongue. Once you're over the tongue, you basically advance. You can slightly advance. Relax your big wheel, and it'll just go in. Okay? But go in with a little bit of thumb towards you, but hold it from here. You should have a nice firm grip on the scope. There you go. Right? Now just advance it, thumb towards you to get over the tongue. Right? Thumb towards you. But don't spin inside. You can't do that. Right? You have to stay on the एक second दिखाएगा. Yeah, that's good. Like that. Is it going easily or not?
No.
Okay. Let me see. Let me just see 1 second here. So, again, just like ERCP,
Yeah.
I have it about this much.
Okay.
Okay, so get over the slide bend, get over the tongue. So here now I'm hitting the back of the tongue, so I have to thumb down even more.
Okay.
Now I'm over the tongue. I relax my big wheel and I advance. I'm going to let you try one more time. So you have to have it at about 90 degrees, okay? So try that. So thumb down even more. There. Okay, relax. Relax your big wheel. And it should just slide in easily. Are we through? Good. And then usually 35, 40 is G junction, right? So you're going to keep going down. Keep going down. You still have esophagus. Okay?
Sorry,
Yes.
Mustafa, I'm sorry,
Yes.
but I'll probably be disturbing you a little bit. Wasim se zara pooch lenge, please, if the next room is ready.
Sure.
They'll do that. You just keep
Okay.
standing.
So now you're in the you
neutral
have,
position
you
and
have you have the heart to the right.
No, it's not.
It is ready.
No, it's not. I can see the lady just walking in there, the patient, so we've got plenty of time.
Nahi ready. Keh rahe hain. Okay.
I know. I know.
Okay. So
Don't
yeah.
worry,
So
don't
look
worry.
endoscopically. Endoscopically अपना view देखें. And just see where. So drop your left hand right. Don't pull back too much. Drop your left hand to where is your gastric lumen. Drop, drop, drop. Drop, advance. You're still in esophagus. Advance. Keep advancing. Keep advancing. Keep advancing. Keep advancing. Now you want to get over that ridge. Now you can go section. Good. And now go clockwise.
So into the stomach.
Just past. Yeah. You can now pull back a tiny bit, but just go clockwise. From here now you get clockwise. Good. Keep going. And one thing I would recommend is thumb down. Exactly. They keep going clockwise. Keep going. And there, what was that structure? Right there.
This one.
Yeah. What is that?
This is aortic.
Okay. Good. So now you can maybe pull back a bit to get a more linear approach. Now go clockwise. There you go. You see that?
Yeah.
Now what you have is
got the
beautiful.
Pleura.
No, you got the the crust, right? The crust of the diaphragm.
Okay.
So let me just. So here's aorta. So keep the aorta in view. Just stay there for a second.
Yeah.
Okay. Crust of the diaphragm here.
Yeah.
And now if the crust is here, the branches are going to be lower down. So gently advance your scope, keeping the aorta in view. Just gently advance. There you go. That's it. Now
Yeah.
pull. Yeah. Now go counterclockwise, and you will see the celiac take off. See that?
Yeah.
Good. Celiac, SMA.
Yeah.
If you have celiac, just go now.
Yeah. This one.
That's the celiac right there. A tiny fraction in, just a little millimeter in. That's it. Now go clockwise. Now go clockwise. Keep going clockwise, and there's your left adrenal. See that?
Okay.
So you have celiac. You go 90 degrees clockwise, you will get left adrenal. Kidney will be here. Now if you keep going clockwise, there's left kidney. Keep going clockwise, and maybe just pull back a tiny bit. Pull towards you, and go counter a bit. You should have spleen somewhere here.
Again, you put adrenal.
ये ऊपर adrenal है ना, because आपने pull किया ना, तो it went away from
ये
you.
किडनी के बिल्कुल ऊपर जो
ये
बाईं
kidney
शाबान
है,
है।
बिल्कुल. ये adrenal है, this is kidney. And यहाँ पे you will have, if you thumb down करें, pull down है, because you should have you should have spleen here.
थोड़ी ये तो hypo
Yeah,
आ
this
रहा है।
is the spleen right there. ठीक है? Now if you go opposite, now you want to go back towards the midline. So you undo what you just did. So counter, there you go. Now you have your celiac. Show me your celiac again. There. Now follow the celiac in. So gently advance, keeping it in view. Relax your big wheel a bit. Advance and go clockwise. And there you go. You have your pancreas. See that? So now you go clockwise. I'm going to just make this a bit bigger. Okay. So now
So this is pancreas.
we had pancreas. I don't know if we lost it, but relax a bit.
Come back
and
again.
yeah, there you go. That's your pancreas.
That's
So now relax your big wheel
okay.
and go counter. So away from you. And that's it. Keep going
Big wheel
away.
away.
No, sorry, the counter, the turn leftwards.
Clockwise flow position.
Yeah, and so there's your, I think, pancreas. It's not the best view right now. So just let's just find celiac again, okay?
Okay.
So there, right? So liver, go clockwise from liver. There you go, right? Now find your celiac again.
Yeah.
Okay, advance. Celiac. Relax your big wheel. थोड़ा सा इसको spin करें left right with your wrist the other way. There's your celiac, right?
Yeah.
So relax your wheel as you advance forward. Advance a tiny bit. And now go clock. This is your pancreas. So now you have to center that. If it's away from you, then you have to advance your scope in more. So relax your wheel and advance your scope. There. Now go this. This is your pancreatic duct. And if we want to
The top
confirm
one?
the top one.
And then lower down is the artery and
I
splenic
think
artery
so, yes. And if you want to make sure,
Yeah.
right, we just put flow on it.
Yeah.
There you go.
Okay.
And there's your pancreatic duct, right?
Pancreatic
It's
duct, then
dilated.
artery and followed by vein.
Yes. Okay? So now you have the duct in view. Now what you want to do is
Follow the duct.
Follow the duct, exactly.
How-
and you
how
have
do we follow it?
so what you do is first you bring your hand back, that's good. Support it. Now if you go clockwise this way, you're following it towards the tail of the pancreas. So now stop. See what's happening? Your duct is up
It is
there.
going away.
Yeah. So you have to push now, exactly.
Yeah.
But you have to
Keep
keep
it
it
in
in view. Try and keep it in center.
Yeah.
There you go. So
And then clockwise.
yeah, so now it's on this side. So keep going clockwise. You have to pull back a tiny bit now because you got too far from there. Oh, so that's
Very
the
small movement.
yeah, that's exactly. And sometimes we'll do that.
Okay.
That you just have to be
It's okay
very.
now?
That's perfect, right? You can see it in the middle. You see it slightly dilated, and then you go clockwise.
Then again it is
Yeah.
slipping, so I need to
So
push.
maybe push forward, maybe
Push a bit.
section a bit. There's the spleen coming into view, by the way. So just relax your big wheel. There you go. So it does kind of slip off on you. That's okay, because we know her pathology is on the other side.
Okay.
So
this is
yeah.
where it is.
Now go to the other side. Go counterclockwise. Okay. Now, so one thing is when you start getting air, you see what's going on. There's air there. Two things, yeah. So suction, and then big, exactly. There you go. And now you see what you did. So go back the other way. Do the opposite. There's the pancreatic duct.
Yeah.
There, as you go counter away from you, you see it coming
It
down.
is dipping down.
Exactly, dipping down, right?
देखते हैं ये
Yeah.
ये
See?
ये नीचे
ये
आ
नीचे को जा रही है.
गया। ये ampulla है नीचे
नीचे नहीं होगा अभी. This will be the splenic, the confluence. The ampulla will be lower down. I don't know if that's so. So here, so basically now go clockwise for a second. इधर ही रहें. It's not very obvious to me, but we should see bile duct, and about you've gone back to the left. So go. There you go. Keep going counter. Okay, here now advance the scope a tiny bit. Thumb towards you, and go clockwise. And there you will sometimes see the duct go down this way. But I think that's the best you're getting from this area right now. Okay, but oh, there it is.
ओके
Sorry.
फ्रीज नहीं किया तो नहीं देख सकेंगे पिछला
नहीं वो देख लेंगे. इसको मैं हटाता हूँ और this is your bile duct because that's the stent in the bile duct. There's the pancreatic duct. So pancreatic duct comes down around like this and goes down, and then this is the very dilated CBD with the pancreatic stent because that's she's obstructed lower down. Okay? So now we're going to go into the bulb and see what we can see.
You want me to continue?
Yeah, So because it's like ERCP, right? So just big wheel towards you. So remember this is side view, right? So you have to big wheel towards you. It's like in ERCP, you have to get over it to get inside. So wait, before you do that, stop. Pull back a bit. And big wheel all the way towards you. More. Now advance. There you go. Because otherwise it's like a side where you're pushing against the gastric wall. There. Now stop. Okay. Now drop your left hand away from you towards the floor. Because you want to get this wall, suction.
You want to go up.
You want this. Yeah.
This.
Left of screen. So don't pull back too much or you'll come back in this right there. Suction. Okay, look at that. You have bile duct. See that? See, it's a dilated bile duct. So this is,
This one.
yeah, exactly. So what we have is, we have dilated bile duct, we have sludge in the bile duct, and we
Yeah,
have
yeah.
portal vein
And
below
you
it.
understand?
The stent you will see, I think it's, you
Maybe
may have to
यहाँ
go
तक
more
ऊपर नहीं आया?
clockwise,
नीचे?
exactly. नीचे है. तो if you, आप थोड़ा सा इसको साथ रखें, scope उसके, so keep it against the wall and now go clockwise. So you pressure दबाए रखना होगा. And go clockwise. There's air because of the stent, so it's hard to make things out.
Okay.
But the stent, there,
What
yes,
is this?
yeah, that's the stent, right there. You see the stent?
What is this?
That your tumor आ गया आपका.
अच्छा.
See, this is the tumor in the duodenal wall.
Okay. ये ampulla का area.
Ampulla का area आ गया. So that's your tumor,
Okay.
and there, if you relax your big wheel a tiny bit, there, that's your stent right there. And now you're falling down, so you have
You
to
have to keep it pushed.
the big wheel up against your wall and go counterclockwise again. There's the stent. You see the walls of the stent. There you go. There's the stent.
Yeah.
Now keep going counterclockwise towards the liver, because you have to be able to look up into the liver. So keep going. Relax your big wheel. Keep going. And if you're looking for liver mets, this is what you want to do, right? You want to see this is the right lobe of the liver. Okay? Now gently go back the other way.
Oh, this is separate.
ठीक है हाँ तो वो बस you
Keep
have to
it
adjust, yeah,
in
you
the
just have to
position.
adjust, and if in doubt just pull back into the stomach so you don't cause a perforation,
Okay.
right? If in doubt you just pull back.
But we can see that.
But if
we are
you're
this
good
close, so
position,
just-
yeah, you're good, perfect, yeah, you had, because you have that view again, right? And this may be the pancreatic duct. Let's just put flow on it. Yeah.
वो थोड़ा सा
Okay. Yeah.
चलो, अब देखो.
So portal vein, bile duct, pancreatic duct, and इसका flow डाल के देखिए. Yeah. See, there's no flow in this. So this is, by the way, the confluence. एक second वापस जाएंगे.
Yeah.
So portal SMV, ये आपके सामने आपने जो flow वाली vessel थी ना, this is the splenic vein.
ये स्पैनिक इस तरफ जाएगी और
हाँ जी. SMV इस तरफ
ओके.
और portal इस तरफ. ठीक है जी? That's excellent. So let me take a look now.
अब आप देखो.
हाँ जी बिल्कुल. सेकंड में मैं देखना चाह रहा हूँ कि क्योंकि इनका काफ़ी ब्लीड कर रहा था just by touching it.
ट्रायंगल से ग्रोथ हो गई.
ये है ना. You see, there is the stent. This is all tumor. So I don't know if you can hear us or see our images. I don't know if it's anyone's there or not. But
ये उधर स्विच किया हुआ.
Gigi, we can.
okay, so you see the mass, right? Endoscopically, there's the mass lesion. We can put the probe against it a bit just to show, but I don't necessarily feel it's right for us to go too deep and irritate it. But there is the mass lesion. Clearly, it's invading the duodenal wall. It involves the bile duct, and we've already done endoscopic biopsies on this.
Right, okay. So it has taken, so there's an infiltrative mass. With endoscopic biopsies.
Exactly, and you can see that it's all the wall layers are gone here. So it's clearly, involving the duodenal wall. And in terms of the size, at least on this plane, it's going to be at least this much.
Big.
It's big, yeah. Which we kind of knew anyway.
Can you get any endoscopic view on it?
Oh yeah, earlier I did, but I'll get it for you again. So you see the stent up there. And you see there's the blood related to the scope trauma,
Yeah, yeah.
and there's all this,
Oh yeah, that's an ulcerative mass. Okay,
Yeah.
I'll leave it. That would
Yeah.
finish the diagnosis, really.
yeah, exactly. And then you saw the bile duct view from the bulb. It was very nicely demonstrated earlier, but again, so there's the gallbladder with sludge in it. And then if we pull back, and let me just find the bile duct here. So we have liver, gallbladder, and there's mass. And then as I go counterclockwise from there towards the hilum, I'm having a hard time orienting. We had a better view earlier, to be honest, with our candidate. So maybe I'm too far down. I
No,
think.
that's okay. That's fine.
Yeah. Okay, so I mean, I think. हाँ ज़रूर मेरी साइन देख लेते हैं. And the other thing I would just, what is that? Is that the lesion?
That's a lymph node, really.
Is it? Yeah, that's,
Yeah,
like, that's
that-
a huge node.
That's a huge lymph node, yeah.
Yeah. Stomach. Say this is a mesenteric lymph node. Because see, this is, yeah, that's a very large lymph node. This is SMV at the top, and you should see SMA here. So this is mesenteric vessels as seen from the gastric antrum. And if you want to double check which one's artery, which one's vein, again you can do the power flow here, and basically
How do we move that two lines? How
This
do you
is
adjust
arterial.
that two lines?
these
To
two,
be placed, how do you move that?
this, once you put it on, you can go up and down.
Okay, with the
And
roller.
with the
It
roller.
moves with the roller.
With the roller. And then secondly, what you can do is you can also widen the window on those lines.
And that, how do we do?
I believe it is this one.
So if the artery is big, you need
Sample
to widen.
volume. Yes, exactly. नहीं ये इसका जो ग्रीन वाला है ना उसको बढ़ाना है. उसका एक तरीका होता है, बट मुझे ये हो गया.
किस तरह किया?
तो ये वो एक्चुअली बताता है आपको. इट सेज सैंपल वॉल्यूम ट्रैक बॉल. तो ट्रैक बॉल से किया है. ठीक है. सो दिस इज so now we're looking from the antrum at SMA, which is the top one, and SMV, and these are lymph nodes. That's a lymph node there.
So it's advanced disease.
Yeah, this is very advanced. And then the other one was really big. This is a large node. And
there are multiple nodes.
there are multiple nodes. So in our practice, we would sample this. Here, I'm not sure if it's necessary, but at a minimum, we should measure it. So 2.4 by 2.3.
Large lymph node, isn't it?
Yeah, it's large. I wasn't going to sample it. It's a mesenteric node. She has a, I think it has all the characteristics. So in terms of malignancy, it's large, it's round, and it's hypoechoic. Even though it's got malignancy, even though it may have some echogenic foci inside, overall this is a very malignant appearing node. So we don't need to sample that. And the other thing is, so she's got nodal disease. The only other sort of thing that would make it even worse would be if there are any liver mets. So as part of staging, when you do these, you want to be scanning the entire liver to make sure that you don't miss.
You're looking at the left lobe.
At the left lobe, yeah. Limited views of the right lobe, I didn't see anything. But sometimes in these, you can find. And the thing with the liver is,
And those who's got hyper reflecting boundaries are portal vein.
yes. Wait, hyper is portal vein or
Those are hyper reflective.
they're vein? I can't remember if those are.
Yeah,
those are
these
portal
are
veins,
portal veins.
and the ones without the wall are
Hepatic
hepatic veins. Exactly.
And how do we differentiate this? With the flow we differentiate as the ducts.
You can, yes. In a dilated system, you can make it. It can be very obvious, but the alternative would be to put flow on and see, because here you see there's central ductal dilation, right there.
So these are ducts.
Yeah,
these
those
are ducts?
dilated
Yeah.
ducts. Yeah.
Fair enough.
The other thing is with liver metastases, they don't have to be hypoechoic. You can get liver metastases that are bright in appearance and hyperechoic. So one thing is you go to one extreme, you don't see lesion, you go any lesion, you keep going clockwise,
Okay.
and you keep going till you lose the liver completely, and you still keep going because this is actually right lobe now, because it's the posterior
Okay.
IVC area. So you keep going till you really have lost it and almost in a 360. And then what you do is you go back to your start point, pull back a little bit, and repeat the same process. So you keep doing that throughout so that you evaluate as much of the liver as possible. दो मिनट दे दें बस वो mediastinum कर लें. So go ahead and now look at the mediastinum. So
Coming back, so
Yeah.
we should follow the aorta first.
yeah,
or
you, or
directly?
I just usually, if you want to do it systematically, you can. However, this is showing you. If you thumb down, relax. There you go. So you basically found your left atrium,
Yeah.
and if you spin around, you will left ventricle.
Okay.
So mitral valve, left ventricle.
Okay.
Go clockwise again. Aortic valve
Yeah.
and aorta.
And right pulmonary artery.
Yeah.
And
if-
I need to withdraw.
Just withdraw a
And this is
tiny bit,
subcarinal space.
subcarinal space. And if you just
Right.
spin gently, like clockwise, counterclockwise, go the other way now. Yeah, that's it.
And this is, and then you go
Then
down.
you see
to
this,
the
yeah, there's a
arch.
little lymph node, yeah. Yeah, so Khalid's technique actually was really nice. I don't do it that way, but
Okay.
you can certainly do it that way. I usually follow
So-
the aorta.
this
Once
is
I have the
the-
aorta in view,
Yeah.
I just pull back.
Okay, that is the bookish, more bookish way.
Yeah.
That I have read it in the book.
Yeah, and
you
then,
withdraw.
okay, that's it, yeah. You
And
don't want to
there's
withdraw
first
too
there is
much.
bronchus, and then arch.
Yes, so you already passed the arch though, so you want to
Okay,
just
so
gently
just
advance.
go in.
Yeah. I don't know what-
Yeah, this
there.
is arch.
Yeah, now if you do thumb down,
Okay.
thumb
And
down
just
and go
push.
clockwise, go clockwise a lot. Thumb down some more. Towards you.
Okay,
Sorry.
towards me.
Yeah, that's trachea. Let's find the arch again.
Just go
So,
in a bit.
yeah, too far. So come back.
I was just going back.
Oh, yeah, no, that's good.
See what this is right pulmonary artery
Yeah.
just above.
Yes. So go ahead and find the aorta. So spin, other way. Make sure you have your thumb down a bit so that you don't get artifacts. Big wheel down a bit, like towards
Towards
you.
me.
Yeah. And don't pull just yet. Just
Okay.
go counterclockwise. That's it. That's it. That's it. Okay. Now pull. Now pull back.
Pull back.
Yeah. Find the aorta now. There's the aorta, right?
Yeah.
Now keep pulling till you have the arch. Now stop. Now thumb towards you.
Okay.
Advance tiny bit. Advance a bit so you push this in. Now that's it. Now thumb towards you and go clockwise. Thumb towards you, go clockwise. Thumb towards you more. And pull back a tiny bit as you go clockwise. Thumb down towards you.
Thumb is towards me.
Okay, let me show you. I would do it. Band kar. So
So now,
yeah, so just find your aorta.
LA,
Right.
LV,
Yep,
aortic root,
exactly. Pulmonary artery.
right pulmonary artery above.
And then this is aorta. So I'm following the aorta up, right?
Okay, you just follow
You're
it.
following it.
You are withdrawing it to follow.
Follow it,
It is-
exactly.
it is coming out.
Yeah. And now I have the aorta, and usually here,
ये साथ की दूसरी
ये दूसरी लेकिन इसमें इतनी आसानी से अच्छी नज़र नहीं आ रही, but it's
हाँ, थोड़ी सी आई थी अभी।
थोड़ी सी वो बस yeah, but that's the area.
Okay.
This is the area.
This is aorta and
And
here
pulmonary
will be the
artery.
pulmonary
This is the pulmonary artery. Okay? And there you can see there's tiny little node,
artery. Yeah,
but it's inconsequential.
it is not rounded, it is irregular,
Yeah.
rounded, so it is likely to be benign.
Benign, exactly.
Yeah.
Thank you very much. Zabardast.
So intubation easy है तो you
ERCP की तरह करें.
a bit dip down.
I would say about 90 के करीब करें.
थोड़ी सी ज़्यादा उसको dip करना
Dip
पड़ता है.
करते हैं और to get over the tongue. और एक दफ़ा over the tongue हो जाए फिर you can extend it a bit because the esophagus is posterior and then you can just advance. I mean I do exactly the same with the ERCP. वही it's the same.
So थोड़ा सा इसकी नई चीज़
हाँ नहीं exactly you want to be comfortable
दो
with the
साल के
feel
बाद
of
जब
it.
करें तो then you